Well, in the United States, people in white society, even though a lot of them are dealing with the same high gas prices that all the rest of us are dealing with, the healthcare issue, that's a problem for everybody. It's not just, toward one group of people. We all live in the same country. But this one woman is going to focus on the healthcare aspect in this video and why we really don't have a national healthcare system here in America. I want you to hear her reasoning and thoroughly explaining how people in her community feels about national healthcare and why we don't have it.
I have some friends in Germany, and they were asking me why on earth Americans would vote against national health care. They can't conceive of it. They told me how great it was. They told me just all these really, really good things about their healthcare system. And it blows my mind, And he just didn't understand it. He can't understand why we wouldn't be in favor of something like that. And then I had to explain to him that a white Republican Christian would rather die slow, miserable, painful death, watch their children die, watch their loved ones die, their wives, their husbands shrivel up to nothing, sick and decay, sometimes for years on end, than go to the polls and vote for national health care to save their own lives. Because if they do that, then black people and brown people will also get that same exact health care, and they would rather die. They'd rather die. They'd rather watch their children die. Yeah. He couldn't believe that. He just couldn't believe it. And I said, believe it. That's it. You ask a Republican one of their biggest issues in the world, they're going to tell you health care. The costs of health care. Terrible health care. Going into debt. And then you start mentioning, it's something about national health care. You just try to squeeze that into the conversation, and their first thing's going to say, yeah, but we can't just give stuff away for free to all these freeloaders. There it is, babe.
That is evil. That is extremely evil. You rather deal with high health care. You rather go without proper health care, go without proper medication, go without certain preventative care, just because you don't want black people getting it. You rather, as she said, suffer and die than to have national health care. I've said a long time ago, national health care should be something that no matter what side of the political aisle you're on, no matter what color, whatever the case may be, what religion, I think we all can agree that healthcare should be a right, not a privilege in a civilized society. South Africa got free healthcare. South Africa. That's one African country that has it. South Africa got free healthcare and the United States of America don't have it. They have other European nations have free healthcare, but America don't have it. For the simple fact is, like she said, is that they rather die than see black people get it. That's crazy. I mean, it's crazy, but the depth of evil and what they choose to suffer. So you mean to tell me that in these little enclaves, where the Hills Have Eyes enclaves you guys have, or wrong turn enclaves that you guys have? Well, yeah, shoot, you want to see them kind of places, go to West Virginia. Ooh, Lord, go there. You'll see them kind of places. But they rather deal with all them problems, poverty and everything, dying of things they shouldn't even die from. And they cool with that long as black people don't get it. That is crazy. But I say y'all dedicated, y'all dedicated to that. Y'all dedicated. That's crazy. That's utterly crazy. And that's why, anybody throughout the world asks the question. I remember when I went to the dentist office when I was in Istanbul, and I talked to a man from the UK. I actually talked to, it was a white guy, and it was a Somali sister. She was a citizen of the UK, but she was in Istanbul as well to get some dental work done. And when I told them we don't have, a national healthcare system like they have, the NHS system, they say, what? Wait a minute. Every time you go, you got to pay. I said, well, you got to have insurance. And I say, insurance, you got to pay a copay. He said, okay, well, what if you don't have insurance? I say, well, I mean, they do have like this Affordable Care Act thing. I say, like an insurance, but it's not the best at all. So they say, well, but how do y'all as citizens put up with that? That's what they asked me. How do the citizens put up with that, not having a national health care system? How? We don't understand that. He said, we would go crazy if they made us start paying for health care. I said, yeah, but your country actually cares about its citizens by paying for health care. Canada is another country. They actually care about their citizens. They know it can be done. But in this country, once again, because they hate black people so much, they don't want black people to have it. They will, if they can figure out a way for them to have national health care and everyone non-white don't get it, then they're cool. They're cool with it. They'll sign that up today. But for black people, no. No. Because if they feel national health care come in and black people live a lot longer than them, that's what they feel. So no, they'd rather go on and go to the grave before watching black people. But you know what? It may be cheaper in the end to do national health care. And the people got to get on that kind of movement anyway. I know they were talking about Medicare for all and all that. No, it just needs to be just free health care, and we just need to pay taxes. And I say how to pay the taxes for it is just to put a federal sales tax in everything that we pay. And that goes to pay for it. Just that simple, a federal sales tax. That way anything we buy is going to that healthcare system. We won't even notice it. We already had prices go up. Look, I'm cool with paying higher prices for something. If it's going to help everybody, I'm cool with that. I can go to the doctor and not worry about, paying anything. I'm good. Now, if it has to be like something cosmetic, okay, then that's something you have to pay for because that's cosmetic. But let's say it's something cosmetic you need because of an injury that happened or whatever. Okay, then the national healthcare system can pay for that. But we're not talking about the national healthcare system paying for BBLs. We ain't talking about that. No, you pay that mess out your own pocket. But yeah, y'all let me know what y'all think about this, man. Because like I said, the depths of the evil goes very, very deep, folks. I mean, you rather not have no health care just so black people won't get it.